everyone. Welcome back to the Her Guided Evolution podcast. I'm Dr. Shanice Jones Cameron, and today we are joined by a special guest who I'm super excited to talk to, Dr. Zarya Rubin. Dr. Rubin is a Harvard-educated functional medicine physician, a TEDx speaker, and a burnout expert. She helps passionate, high-achieving women get to the root cause of chronic symptoms and stress so that they can heal their nervous system, achieve greater balance, and truly thrive. Welcome, Dr. Rubin. We are so excited to have you today.
Thank you. I'm so excited to be here.
Yes, thank you for joining us. So we'll go ahead and dive right in because I have lots of questions. I'm very much interested in functional medicine and kind of like the holistic kind of perspective of the body. A lot of my academic research engages with kind of like the ideas about holistic health and how we talk about health, how we define it. So really excited to talk with you. So one of the questions that I just wanted us to get started with is, how did you become interested in health and medicine? And can you tell us a little bit about your journey, and did you always want to become a medical doctor?
Yeah, sure. It's so funny. It was somewhat of a surprise to my family, which I found hilarious because I had wanted to be a doctor for as long as I could remember, probably since around age 5, and I would treat my sister's dolls and give them ailments with markers and like measles or whatever, and then, do surgeries on them. It was hilarious. But I think that actually, there's no doctors in my family. So I think that stemmed from my own personal medical challenges and experiences as a very young child. And I had a lot of, kind of semi-serious and serious medical issues. And I think that really kind of puts you in the mindset of, oh, I'm curious about this. I want to learn more. I want to be on the other side of this and be able to help people rather than be in the role of being the patient. I wanted to be the one healing and helping. So it got started very early on.
Oh, that makes a lot of sense. I would imagine kind of having those childhood experiences, so that would kind of inform kind of your approach and I would imagine like a sense of like empowerment and control, I would think, from kind of stemming from that.
100%. I think that was part of the rationale for why I decided to pursue a career in medicine. But I will say that early childhood trauma is probably not the best foundation for choosing a career path, but it led me here. It's been a lot of twists and turns, but it certainly informs you as being a very compassionate physician and healthcare provider, because you have been on the other side and you know what that's like.
Sure. Yeah. Could you perhaps elaborate a bit about your early childhood experiences and how that kind of fits into kind of like your career journey?
Yeah. So, I think that when I was very young, I had some, a misdiagnosis that was actually really terrifying. And they told me that I only had a few months to live. Obviously, that was a misdiagnosis, but that was very impactful. And, that whole process of surgery and this and that and misdiagnosis was, it's a lot for a young person to take on. And I think that stuck with me as like, okay, I want to pursue this. I want to understand the human body better. I want to be doing the best that I can for patients and not delivering, this kind of shocking news that ends up being like, oh, well, actually we made a mistake and you're actually fine. So that was really scary. And then I had another serious medical issue as a teenager and had to have complete spinal surgery and spinal fusion, was in the hospital for many weeks, missed most of my second to last year of high school. And that's a lot for a teenager to go through at that stage with body image issues and, just feelings of disability and that missing that piece of like carefree childhood of like, oh, when you're a kid, you sort of think you're invincible. I never had that. So I was always very concerned about, my health and the health of people around me and the body and how it worked and what makes it work and how does it break down and how can I fix it? And really always like, how can I fix it? So I became like kind of a fixer mentality and was always trying to help people. And that's really what led me into medicine.
Yeah, really. Thank you for sharing that. As you were talking, I myself have had a couple years ago, I had a pretty serious medical diagnosis. I'm okay now. But I think as someone who has kind of experienced like that conversation and diagnosis about something that's ultimately life changing, I think one of the aspects that I think isn't explored explicitly enough is like the emotional impact of something like that, that just kind of like a random day just kind of shatters your world in the moment in which how you understand it. So could you speak a little bit to the emotional impact of maybe stemming from your childhood experiences with health, but how they kind of reverberated into your adulthood and impacted your life and your education, entering into your career?
Yeah, so I mean, that really kind of delves into the realm of early childhood trauma and complex PTSD, which is something that maybe not everyone's aware of. You know, people are definitely aware of PTSD, which is kind of a more acute, really serious traumatic experience that happens maybe once. Maybe it's a huge car accident. Maybe it's an assault or something terrible happens to you. It's very traumatic. You can end up with PTSD. But when you have complex PTSD, it happens much earlier in life and it's a repeated event and repeated trauma. So because I had all of these medical issues and some of them were very prolonged, it's a long story, but I think that what that does is it creates a lack of safety in you as a person, as a young person. And so you are always a little bit on guard and living a little bit in this fight or flight mode because you're always worried about what is the next thing that's going to happen to me or what's around the corner or what bad thing is going to happen. You don't have that sense of safety and of sort of earned self, peace and tranquility in your body and just being like accepting. And so I found myself really trying to avoid all of that by striving really hard and being really successful. And so I found that if I was constantly working, constantly achieving, then I could sort of quiet that down and not focus on all of that trauma. Let me tell you, it eventually catches up to you. And it really, it caught up to me in my 20s and 30s, but I just kept pushing it away. In my 40s was when really I could no longer sort of outrun the trauma, and it became impossible to live this double life. So I would live my life outwardly. Everything was great. I was super successful. I had this beautiful family. But on the inside, I was reliving those early childhood experiences. And so it created this split almost. And so you have to keep up appearances and you're leading your outward life and you're busy and you're successful and you're trying to carry on conversations. But inside, you're kind of worried about your own safety and survival at all times. And that is not sustainable. So it eventually, I think it came to a head much earlier for me in my 30s when I ended up walking away from practicing medicine for a long period of time and had significant burnout. Now, what I didn't know at the time was that it was burnout, and what I didn't know was that early childhood trauma is associated with burnout later in life. So that was really interesting as I delved deeper into the field of burnout and just how we push ourselves so much in current society to the point that our mental health is affected. Also, our physical health is affected by it.
Yes, I think that's such an important point. And I've never made or really heard the connection between early childhood trauma and burnout. So if you could, for the audience, could you please explain that connection a bit more, as well as define what you mean by burnout and what that looks like in day-to-day life.
The concept, I guess I'll start from the end and then back up to the beginning of your question. So the concept of burnout, I think it's kind of at an epidemic, inflection point right now. I think post-pandemic, we all just were pushed to our limits, and we've never seen such high rates of burnout. Last year it was epidemic proportions. Like, I think it was like 89% of workers reported being burnt out. And in 2021, when we were at the height of pandemic, burnout was the number one reason cited for leaving a job. So it's definitely exploded, but it's not a new concept or a phenomenon. It really came up in the early 70s. A couple of different psychologists observed this phenomenon and coined the term. So there's a German-American psychologist, Herbert Freudenberger. He was working in a clinic dealing with drug abuse and like really severe consequences of drug abuse. And that was where the term originated, burnout. But he applied it to the consequences of severe stress in the helping professions and applied it to himself. And he had also experienced early childhood trauma, ironically, during the war. And then in the late 1970s, Dr. Christina Masloch, who's a psychologist, she further did studies and research into defining burnout and creating these inventories. And so she really described it in three ways. So like three classic characteristic hallmarks. Number one, exhaustion. Like, people who are struggling with burnout, they suffer from this tiredness that goes far beyond just like, oh, I'm tired, I'm stressed out, didn't get enough sleep. It's like a bone tiredness that you can't fix, by taking a couple of days off. And the second one, which is really kind of difficult to define and to fully grasp, it's like this cynicism around work. And so you start to lose interest in what you do. You start to sort of lose hope and trust in the organization, in your colleagues. You start to believe that nothing really matters, that nothing you do is impactful, and it just creates this kind of negative attitude. And then lastly, of course, it's like decreased productivity. So, when you're suffering from burnout, you're not focused, you're not doing your best work, you're more distractible, you're more irritable, whether that's at work or at home. And so those are the three classic hallmarks of how people define burnout in the literature. And it's kind of like, well, if a lot of people, I think, don't necessarily believe that they have it. It's kind of like one of those things you're like, oh, I don't have that. Oh, I'm not burnt out. It's like, I'm just tired, or I'm just stressed, I think I personally was very hesitant to admit it. And I don't think I admitted it until years later. I had no idea. There wasn't enough knowledge around it, education around it. It was just kind of like, you have to keep pushing, and you have to keep working, and you have to keep grinding. So back to the beginning of your question, the connection between early childhood trauma and burnout, I don't think we fully understand that. My hypothesis probably is that when you suffer from early childhood trauma, your nervous system is already taxed at an increased rate of this constant lack of safety, constant fight or flight. You've already got higher levels of stress hormones like cortisol. So you are definitely more at risk for developing burnout.
Really interesting. And I think that hypothesis is definitely holds some truth. So I'm thinking about how you define burnout, and that's very helpful because I think to a degree, definitely after the pandemic, I think that burnout has become even more of somewhat of a buzzword. And I don't know that we are, as a society or even as individuals, are fully grappling with the actual definition, what it looks like. I think at times it may kind of be a stand-in for I'm just tired. So thinking about what you laid out and what you mentioned with burnout. So just to kind of sum up for the audience as well as just for a clarification, burnout, when you say burnout, when you think about burnout, one is like this extreme tiredness, like bone tired, not just a typical like, oh, I just need a nap, like extreme tiredness.
You take a weekend off or you take a vacation and it doesn't really get better.
Yes, okay, that makes sense. So extreme tiredness, you said cynicism, or like this kind of lack of morale that is just kind of like, I presume, pretty overwhelming. And then three, a loss of productivity. Yes. So that is very helpful. So anyone who's listening, these are like the telltale signs that it may be a little bit deeper than I just need a weekend off to rest and reset.
And you can also have all of these sort of insidious physical manifestations too. So you can have headaches, you can have insomnia, you can have, your immune system can be impacted. You can have GI issues, stomach issues, reflux. You can have musculoskeletal pains. You can even have cardiovascular issues along with burnout. So if those things are coming up in the context of these other, classic characteristics, you should definitely think about it.
Yeah, that is so helpful. And it's funny that you went into like the physical connection, because that was actually my next question where I was going next. Thinking about burnout, and as well as like the connection between burnout and early childhood trauma, could you elaborate on like perhaps what is known about the physical kind of long-term impact of burnout and early childhood trauma, like on the physical body, and then perhaps speak a little bit toward functional medicine and the role that functional medicine could play in perhaps alleviating or addressing some of these issues?
I think that many cultures over the centuries have recognized that there is a mind-body connection and that they are intertwined and intimately linked. I think in Western culture and Western medicine, we have really tried to separate the mind and body. That is actually changing now over time, and that we are really discovering just how connected the mind and body are. Now, whether that comes from studies that look at breathing and meditation and its impact on things like the cardiovascular system, blood pressure, heart rate, the immune system, or whether it's all the work that has been done looking at the gut-brain axis and the connection between your brain and your gut, that gut feeling, there's actually a scientific basis for it in terms of just the number of neurotransmitters that are produced in the gut. Things like serotonin, 95% of your serotonin is made in your gut. So that impacts your brain and your mood and your thinking, and 50% of your dopamine. We also know that the vagus nerve, which is the most important nerve that controls the autonomic nervous system, and the parasympathetic nervous system, which is kind of our rest, digest, calm. It's the opposite of the sympathetic fight or flight. That nerve, 90% of the input is going from the gut to the brain, not the other way around. So we're really learning more and more and more about just how interconnected the mind and the body are, that we can influence our physical body with our mind. And we know this. We know that depending on your mood, you can withstand pain better. They've done studies on this. We know that our breathing can influence our pain response, and so many different ways that our physical body and our mental state are connected and influence each other. And I think that's something that functional medicine really looks at closely and carefully. And that's one of the things I love about it, is that we really do take into account the whole person, the whole body, the mind, things like stress, the impact of stress, things like sleep, your diet, exercise, all of the interconnected body systems and how they work together, rather than just looking at maybe one symptom or one body part in isolation and saying, well, yeah, no, none of this is connected. Well, last time I checked, it is kind of all connected. So that is really what we look at, and we look at the dynamics, we look at the balance of things. We're always trying to balance, hormones and neurotransmitters and, the effects of different things, your toxins and how you clear those from the body. And so that's something that's kind of exciting about functional medicine. I think it is definitely a great tool that helps us focus on health and balance rather than just like treating the symptom. We're trying to look at the whole system and how it works together and how we can really make it work better and get to the root cause of things.
Yes, that's really interesting, as well as it kind of intersects with some of my own academic research. When I'm teaching, I often tell students that yes, like our medical system and kind of how we tend to think about the mind and body as separate in a lot of instances, which I totally agree is changing. But I tell them like, hey, this is rooted in Western philosophy because some dude named Rene Descartes said the mind and body were separate. So I'm always thinking about these questions and thinking about like this need for this like holistic approach. So when we think about like biomedicine, which we can think of as like the standard kind of Western approach to medicine, which definitely necessary, wholeheartedly support modern medicine. Just want to emphasize that here. But thinking about kind of like this biomedical orientation to health, can you speak to like how functional medicine may be a bit different in like the role functional medicine can like play in someone's health, maybe in connection to like how we think about like the typical standard kind of healthcare in the United States or in the West more broadly?
Yeah, absolutely. So obviously I'm a big fan of conventional Western medicine. I'm a product of it. I went through the system and was educated in it, and it is invaluable, certainly for treating serious illness and emergency things and surgeries and, trauma, all of those things. It's hugely important. And I think that it's complementary to really look at something like functional medicine. And there are certain circumstances where maybe one is better serves you than the other. And I think that oftentimes in Western medicine, we're kind of waiting for the horse to be out of the barn before we're closing the door. And at that point, it's sometimes a little bit too late. So we are waiting for someone to have florid disease before we treat it or diagnose it. And in functional medicine, we are trying to get there earlier. And we're trying to look at the dynamics and be like, maybe you don't have thyroid disease yet, or you don't have diabetes yet, but there are trends going in that direction. Let's try to move them in the other direction. Let's try to change the story. Let's change the dynamics. Let's try to rebalance things. Let's focus on your individual, body and your individual genetic makeup, how that impacts your biochemistry, what that looks like, and try to influence things upstream rather than waiting. So I think that's hugely important. We take a different approach to lab testing and lab values because we know that it's just a number and it's based on averages and it's often based on white males. So we look at that more in context and we say, okay, your labs are not abnormal per se, but are they optimal for you? Given your circumstances, given your symptoms, given your history, given your family history, given all of these other factors, is there anything more we could be doing to influence the course of things and to improve your health, which is obviously the goal. We want people to increase their health span and live happier, better lives. I think we also need to look at things like vitamin J, which we look at in functional medicine, which is joy. and friendship and isolation. I think the pandemic, we can't avoid it. So isolating for so many people, and that has huge health consequences. There are studies that show that, loneliness can be the equivalent of smoking 2 packs a day of cigarettes. So I think we have to take all of these things into consideration when we are trying to address health.
Yes, and I really love what you said about functional medicine kind of taking somewhat of a preventative role, and not necessarily just trying to, I guess, like treat symptoms or treat a disease necessarily, which I know biomedicine is primed for and very helpful in those instances for sure. I can more clearly for sure see functional medicine's role on the prevention side as well. So I'm wondering with that, do you have any stories that you can tell, like maybe notable patient stories that kind of stick out to you as far as like this like demonstrates like the need for functional medicine and how important it can be, particularly in a society where biomedicine is oftentimes our go-to kind of perspective of health and treatment and addressing ailments?
Yeah, I think that I'm going to have so many examples, but I think especially as women, so I see almost exclusively women. It's just that's how my practice is. That's what I choose to focus on. And because my husband is a physician as well, he's a surgeon and he specializes in women's health and endometriosis. So that's his focus of practice, and I get a lot of referrals through him. And so a lot of my patients tend to have these complex conditions and inflammatory conditions, and they've often also been dismissed by doctors most of their lives, just by virtue of the fact that, well, you're a woman, well, periods hurt, the end. And they're like, yeah, no, this is actually not that. And so it's so empowering and impactful just to, I think, give people a voice and to have them be heard. And I think that that is just a problem with the medical system in general, is doctors just don't have enough time within the confines and the structure of the system the way it is. And you cannot fix something in 10, 15 minutes because it's very difficult to get really to what's really truly going on. And so I had a patient not that long ago who was having all kinds of GI stuff and stomach stuff. And because of certain other conditions, I think it had been dismissed as like, well, I don't know, you just have to kind of live with that. There's not much we can do about it. But I was suspicious, so I did some functional medicine testing, and honestly, that could have been checked with conventional testing as well. So I was just curious as to what the gut bacteria looked like. And it came up strongly positive for H. pylori. Now, H. pylori is, as we know, it's a common finding. A lot of people have it. Doesn't often do anything, and you could sort of say, well, maybe it's nothing. Maybe you can ignore it. But in some people, it actually does cause things like ulcers, and it does cause symptoms. So we decided to treat it, and we used a sort of a gentler approach. We didn't do the intense antibiotics. We did an herbal regimen, and it was intensive though in terms of having to stick with it. And it was like night and day for this patient. All of her symptoms cleared up. She was able to eat food again without difficulty. And then she was retested by her GI doctors, and the H. pylori had cleared up. And they said, oh, it was probably just, a coincidence or like an incidental finding, And we were like, what? Like this was for real. This was a legitimate finding. You had all of these symptoms. We treated it. They all went away, So I think it's just a different approach, and it's a different philosophy of like, let's see what we can do. Let's also try to do no harm and not maybe do this kind of a treatment that, and there were different reasons that would have propelled me maybe to go more towards antibiotics versus not. Antibiotics are great, but if you can avoid them when someone has gut issues, you should probably do that because it'll create more gut issues. So I was really happy with that outcome and result, and that patient was doing so well, and so that was very encouraging that this really does work. and it really does change lives. And you have to be a little bit of a medical detective. You have to kind of puzzle piece and say like, what are we missing here? What have we not looked at? What stone could we turn over? And what could we try? And a lot of it is sort of trial and error too, because there aren't massive randomized trials looking at treatments and outcomes. You have to use whatever science there is, whatever makes sense biochemically and anatomically, physiologically, and you kind of go from there, and you're a partner with your patient as well. And let's do this together. I want you to tell me how it's going. If it's going well, it's not going well, we'll change course. And we also try to like give patients some rapid relief. So we'll maybe prescribe a treatment or a supplement that will help right away. And then we're going to, in the background, try to deal with the longer term like root causes and resolving that. And those two things are done in tandem. They're not, one or the other. It's kind of both, and they serve a little bit different purposes, and they help, get the ball rolling and get people feeling better sooner.
Yeah, it sounds like a very comprehensive like approach to health, which I think is very necessary. And part of there's like a portion of literature and communication called in health communication, patient-provider communication. And so a lot of that is about like understanding like these conversations and interactions between like physicians and patients, and trying to increase health literacy, as well as encouraging patients to ask questions and be empowered. And of course, kind of like establishing this more like simpatico relationship between the doctor and the patient and the physician. So I really appreciate that, as well as I can only imagine how validated your patients feel with that approach.
Yeah, I mean, 100%. I agree with all of that. And it really is a sort of a collaborative effort, because it does require a lot of effort on the patient's part. Like this protocol, it was not simple. It required a lot of literacy. And in that way, functional medicine, I think, has a long way to go in terms of it being more accessible to everyone, for so many reasons. But I think that yes, that the paternalistic model of like, I'm the doctor, you're the patient, here's a prescription, go away, like that, we're moving away from that. And I think patients want to move away from that, physicians want to move away from that. We want this to be a collaborative effort where, both parties are involved. And oftentimes my patients will say things, or they'll make suggestions, or they'll be like, well, what about this? And I'll say, you know what, let's try it. Let's do it. I trust you. And I try to educate them to they are the experts on their own body. They're the only ones who can tell me, is this working? Is this change? I mean, yes, I can do labs and things, but I want to know how they feel and teach them to recognize those changes, and also those warning signals and that check engine light in your own body. Start listening to that. Pay attention to that. Don't ignore that. Because you can run the car with very little gas or no gas for a while, or no oil for a while. And then what's going to happen? I don't know. The motor's going to fall out probably. So eventually that doesn't work. So I think we need to educate people to just be more in tune with their own bodies, that whole mind-body connection, and listen. And when your body is saying this isn't working, or I need to take a break, and you need to take a break, and don't keep pushing yourself.
Yes, I ran across, I don't know, I think it was like a video, like a short form video, but it was just offering like suggestions and advice on how we can be more connected to our bodies, because I think about many of us are probably navigating that disconnection as we speak. And part of what the recommendations were, or suggestions, I'll say suggestions, were to pay attention to when you have to use the restroom and go immediately, recognizing when you are thirsty, actually drinking water, and like these bodily cues that a lot of times we're not necessarily like thinking about on a conscious level how important that is for like building trust within your body.
Oh my goodness. I could not agree more. There's actually like a very funny moment in my TED talk that I just gave last month where I talk about how I learned this fascinating thing in medical school that doctors don't pee. And like, because we just would ignore our own bodies and just in the name of like, oh, I'm so busy. I have to keep going. I have to do this. And it's like, no, you have to actually take care of yourself before you can take care of others. Oxygen mask principle.
Yeah, and that's I really appreciate you making that point, because that's something that I was thinking about, and I actually wanted to ask a question related to that. I think oftentimes when you are like a medical doctor or professor or just anyone who's kind of front facing, has a lot of education that a lot of people would recognize, letters behind your name, I think part of what comes along with that is this kind of like this idea that you're not like this full, real, well-rounded person, like who has a personal life and has other things other than the job to focus on. So part I wanted to do is like just kind of maybe ask a few questions and transition into kind of talking about Dr. Zarya like outside of the medical practice, and what your life is like outside of being a physician and practicing functional medicine, and how you incorporate self-care into your lives. Because of course, Her Guided Evolution, one of the primary things that we advocate for and that I advocate for is to take care of yourselves, and the recognizing the gendered aspect of that.
Oh boy, girl, where do I start? So yeah, my life is completely done like a 180 from when I was in medicine. And then after I left medicine, I went right, I was completely burned out, but I had to keep working and, had so much debt. It was crazy. And I went from frying pan to fire to fire. So I went from being, a full-time physician to being an executive at a startup to then being a pharmaceutical executive, and like these high pressure, high power jobs. And then eventually I was just like, okay, I'm broken. And then I became a mom in my 40s. And that was actually probably the hardest job of all, and the one that required also the most self-sacrifice. And boy, did it really affect me. And, mentally, physically, I ended up with severe autoimmune disease as a result of all of this. And so, yeah, my body was literally like, nope, can't do this anymore. So I have taken a completely different approach now. My focus is not my career, although my career is very important to me. I've obviously worked so hard to get here, and I really want to make an impact and keep sharing my message and get out there and talk to people about functional medicine and burnout, because I think it's so important, especially for women. But self-care is my number one priority, because if I'm broken, then I can't heal anybody else. Can't be there for my daughter, my husband, my family, my patients, the greater world at large, and all the work there is to do out there. So yeah, I there's simple stuff. One of the number one things is sleep. Like, sleep is so important, and I am a night owl, so I have to kind of force myself to go to bed early, and by that I mean before midnight, which is not fantastic, but it's a start. And just getting really good restful sleep, making sure that your environment is free of like devices, and if there's too much noise, I use earplugs because I've got all these animals and people in my bed, and finding what works for you, so it's sleep, so important. Eating the right foods, figuring out what foods work for you, which foods don't. I don't eat dairy, and I try to, balance other things, try to avoid processed foods, try to avoid eating a lot of meat, although my family is all like heavy duty carnivores. So that's a balance there. I'm a really big vegetable fan.
Same.
Getting in some movement into your life. And I don't like to say exercise, because that's, a lot of people bristle at that, but just like movement, like going for a walk, walking the dog, figuring out what kind of movement works for your body. So I cannot do hardcore like cardio, because once you've been through burnout, that kind of really intense, HIIT training or hardcore cardio or running, etc., it taxes your adrenal glands. And so I try to stay away from it. I do lots of yoga, lots of bar, strength training, things like that. Very important as we get older. Being outside in nature, I think, is hugely important to me. And I think it's very restorative to so many people. I was actually listening to an expert the other day about just how attached to our screens we are and how much digital input and stimulation, and it's just so terrible for our nervous system and our brains. And so because we are all so surrounded by screens and all of this input and all the stimulation, so he was saying that if you can expose yourself for even 5 minutes a day to something like nature that is literally out of time, that there's no time about it. You're looking at the sky or the trees or the birds, or there's nothing to do. There's nothing to complete. There's nothing, coming at you. It can be so important and so restorative. So I think that's so important. For me, it's also friends and friendship and making sure you have that community. It's so hard post-pandemic also to really get people to hang out again and come out again. And then for me, it's also like I said, vitamin J, hobbies. What do you love to do? I'm a singer, so I sing with the Portland Symphony, and we're doing Beethoven's Ninth next weekend, which is really fun and intense, and singing, and just the act of singing in a choir is they've done all of this research on it. It lowers, risk of Alzheimer's and depression and anxiety, and it's just such a healing thing to be making music in a community and just doing something that you love. So those are kind of the things that I do, when I'm not being a doctor and seeing patients and being a speaker. But I think that everyone has to find their thing, but don't sacrifice it and think that you're not important and that you don't deserve time for yourself.
Or that is something that I repeat all the time on this platform. You are a person, and just because you are a person, you deserve joy and rest and to be the captain of your own ship, as my mom often says. So
yeah, especially if you're a mom, it's you can start to think that maybe you don't exist independently of that as a person.
Yes.
That you simply exist to fulfill the needs of others. And,
yes, for sure.
And that's part of it. That's part of your job for sure. And it never ends, especially when you have young kids. But even within that, to not lose sight or lose sense of who you are as an individual and as a human being, and to make sure that your cup is full so that you can be there for your kids and for others.
I think for sure that I talk about all the time, creative self-care is really important. So I love that you're a singer, and that's really cool, and speaks to hey, doctors are full people who have interests and hobbies, and the fact that sleep, you talked about, kind of just the fundamentals of making sure you get enough sleep. I think that is just such a underrated thing.
It's so basic, but when it is not there, it's one of the first things I do when I see a new patient. I'm tell me about your sleep, because if you ain't sleeping, nothing is working. There's no way I can heal all these other things in your body if you are not getting adequate rest. And that's the first thing we need to fix, really.
That is a word and a message that I think all of us need to hear and internalize. So I want to be mindful of your time, Dr. Zarya. So is there anything that you wanted to, any last words or encouragement or anything that you want to tell the audience that is maybe something actionable that we can kind of keep in mind as we're trying to prioritize self-care and keep our health in mind, and just trying to thrive as individuals and moms and people who have all of these hats and responsibilities.
Yes, absolutely. And this is actually a great segue into what I wanted to mention, which was that I have recently given a TEDx talk at the University of Washington in Seattle, and it's called The One Step to Alleviating Burnout. And in my talk, I talk about something that I discovered myself and that I use with my patients that is so simple and yet so effective. And it is the concept of do one thing less. And it is just that idea that, okay, let's say you have a long list of errands to run or things to do. You know what? Cross one off your list. You're booked in meetings back to back to back all day. Reschedule one of them. And the analogy that I use in the talk, it's a spoiler alert, but I would love for folks to watch the talk and let me know what you think of it. So like imagine you're clearing a table of dishes and you've got all these dishes and they're all piled up and you're like, oh, and then you notice there's like, there's still that one cup left on the table. You know what? Everyone is dying to just pick it up and add it to the pile, which will result in like all the dishes crashing down. Or, you've been like unloading your car with the groceries and you're like, I'm just going to take that last bag and I'll be fine. And then they just splat all over the driveway. So doing one thing less, leave the cup on the table. Make a second trip. Get that grocery bag. Like just tell yourself that it is okay to move something off of your plate. And it is amazing how well that can work. Like it just gives you enough space and breathing room to be like, okay, I'm not going to push myself above my threshold that is putting me in danger of heading towards burnout. Now, obviously it's, it's not one thing that tips you over, but there is the concept of the straw that broke the camel's back. And it is those one things over and over and over and over and over. And so if we can carefully remove just one thing on a consistent basis, we can really just allow ourselves that room to breathe and flourish and thrive.
I love that. That is a perfect place and a perfect note to end on. It goes against like all of our kind of like messaging and Protestant work ethic, and if you're not productive, you're not a good person, or you're not moral. And that is
exactly that we have tied our self-worth to our worth as a productive human in society, and otherwise you are worthless. And we have to start shifting that narrative.
So do one thing less. Yes.
Yeah, that's my assignment for everyone, to see if you can do it. It's a lot harder than you think, but once you get used to the practice, it's really kind of transformational.
It's amazing. Thank you so much, Dr. Zarya. Where can everyone find you? And of course, if you're watching the video version of the podcast, check the description box. And if you're listening to the audio version, feel free to go on to the show notes. I'll have everything linked as well. But where can we find you, Dr. Zarya?
So you can find me on Instagram at Dr. Zarya Rubin. You can go to my website, drzarya.com. I do have a newsletter that you can subscribe to there, and you'll get my free guide that's Burnout to Balance. I also have a private women's Facebook group that is free to join that's called Burnout to Balance. And then, you can check out my TED Talk on their YouTube channel, and that would be fantastic. And I also, I do see private patients one-on-one, a limited amount, but I am always I do save some slots for new folks.
Thank you so much, Dr. Zarya. This was such a great conversation, and I really appreciate having you on the Her Guided Evolution podcast.
Yes, I love it. I love what you do, and I think it's so important. And, we're part of the self-care revolution.
Yes, for sure. Thank you so much. So in today's segment of the editor's note, so my first two interviews, which you all would have seen and heard, depending on if you are watching this on YouTube or listening to the audio version of the podcast, my first two interviews, I had like blatant like technical difficulties to where I had to like at the last minute just kind of make some changes so that I could just actually record the episode. So recording the first episode with Mireille Sine, I couldn't get my camera to work, so that was a thing. And then the second interview where I got my camera to work with Jen Fontanilla, that second interview, my lighting was off and the picture quality was not great. So fast forward to this third interview that I recorded with Dr. Zarya Rubin. The audio was good, my camera was good. So everything was like navigated the challenges from the first two episodes. And so, we were cooking with grease at this point. So when I was recording the interview with Dr. Zarya, it kept freezing. And when I tell y'all, none or neither of the first two interviews were freezing, it's like right when I get all of the hardware set up correctly and properly, the software starts conspiring against me. So just from an editing standpoint, I still think everything came out really good as far as like how I am able to edit, and we're like kind of piecing together the conversation as we're going along. And shout out to Dr. Zarya, because I know that can be really frustrating when you are just trying to make your points. You're trying to keep everything together as far as like this information goes with this information and it kind of flows in a certain way as you're speaking, but then you have to start stopping and restarting. So shout out to Dr. Zarya, because I think she did a great job of breaking down a lot of these terms that we may not necessarily be familiar with, since for those of us who do not work in the medical field. So shout out to Dr. Zarya for just kind of like sticking with me and just kind of hanging in there and doing a really good job of like restarting and resetting as we went along with the interview. So from an editing standpoint, that is what I wanted to share with you all. I just thought that's kind of funny as I am editing right now. And I'm actually going to share some of the bloopers on Instagram. So go over to Her Guided Evolution on Instagram and catch some of the bloopers from the episode. Like we have like this really hilarious moment as I was editing, like where the picture and audio kept freezing, and then right after like we start getting ready to like begin, Dr. Zarya's dog starts barking. So it was just like a perfect storm, but we got it done, and I think the episode came out really well. So go over to Instagram if you want to see like that, like the image of that and like the blooper that goes along with us recording this episode. I recorded an introspection for this week yesterday, but it just did not come out very good. I feel like I was rambling. And so as a result, editing it has been an absolute nightmare. So I just decided I'm just going to scrap that, and the next solo episode, I will maybe bring in some of the elements that I was trying to articulate yesterday and just didn't really plan it out adequately. I also decided that I'm just going to do the introspection segment of the podcast on the weeks where I do solo episodes. Just some transparency, like it's just not sustainable trying to add that into the interview episodes every week while I'm editing on top of editing. So that's just something that'll help ensure that I can get the podcast episodes out, as well as have a level of thoughtfulness added into the introspection segment, because I'm already kind of in that mind space when I am doing solo episodes anyway. So thank you so much for listening. I really appreciate you take some time to hang out with me on the Her Guided Evolution podcast. Take care and be well. Thank you so much for listening to the Her Guided Evolution podcast. Please take a moment and take my free self-care quiz that will tell you your self-care personality. I took my own quiz because, it is just that helpful for giving us insights on what types of self-care we may like and benefit from. And I am the introspector. The introspector is someone who can benefit from like meditations and journaling and looking inward and really getting in touch with themselves. There's other personality types like the ambitious extrovert or the aesthetic enthusiast. So if you are interested in learning about your self-care personality, head over to herguidedevolution.com/quiz and take the free self-care quiz and learn your self-care personality. Thank you so much for listening to the Her Guided Evolution podcast. I will see you next week. Bye.